Hello and welcome for a webinar on mechanical injuries. We are meeting after a long time, hopefully after 15 days. And today we will start with a new topic, and that is medical legal aspects of mechanical injuries. So greetings and hearty welcome to all of you. Once again, welcome to all of you because we are meeting after a long time. And as I said, today we will discuss on mechanical injuries. Dear friends, injuries, the word injury and injuries has got other two synonyms, and that is wound and hurt. In English, injuries, wound and hurt, they go hand in hand, but there is little difference amongst them. But here we are talking about only mechanical injuries. And for that purpose, we need to understand what is exact meaning of injury first. Then you will understand what is meant by mechanical injury or mechanical injuries. So let us understand the word meaning of injury. Okay? And gradually we will come to the forensic aspects of mechanical injuries. An injury is also called as wound, and both are defined as termination of natural continuity of any of the tissues of the living body. So that is also called as breach of continuity. Any physical damage to the body caused by any violence or any type of accident or even a fracture can be called as injury. So injury is a singular word and injuries is a plural word, that you know. So under section 44 of IPC, that is Indian Penal Code, the legal definition of injury we find. So legally, as per section 44 of IPC, injury is defined as any harm caused illegally to a person, that is to the person's body or to the person's mind or to the person's reputation or to the person's property. So there is a very big meaning of injury as far as section 44 is concerned. But today we are not going to discuss about injury to mind or injury to property or injury to reputation. We are going to study only injury to body, and that is why injury to the body is called as mechanical injury. So other things just try to keep aside today for the sake of today's webinar. So section 44, please remember as far as the meaning of injury is concerned. What is mechanism of injury or mechanism of wound or mechanism of hurt, H-U-R-T, hurt? The body absorbs the natural forces like gravity. So anything coming on the body absorbs, okay? And it, including natural forces like gravity, movement, or routine movements like sitting, walking, by the flexibility and elasticity of its soft tissues and rigid skeletal framework of the body. Okay, wound is due to the result of forces which crosses the limits of elasticity or resistance. So if I pull my skin like this, to certain extent it gets elastic because of elasticity and resistance. It comes out to some C. But if I pull it more, or with something, what do you call instrument, it will get torn apart. फाटेल ते. So फाटणे म्हणजेच इंजुरी. तोपर्यंत ती इंजुरी नाही. Okay. So this is mechanism. So for that mechanism, you require a force. Okay. Now, what factors that influence the mechanism of injury or wound? So we'll see one by one. There are some factors. The amount of force applied, which depends on mass of the object and speed. Okay. For example, if you take a baseball bat in your hand and if you hit it on somebody's body, and depends upon what type of baseball bat you are using, how much weight it bears, what amount of force you apply, and to which part of the body you apply. So all that comes. Okay, so that is object and the speed. The distribution of force over the surface of the body is another factor. Example, if large area of distribution is there, there is less damage. And if small area of distribution is there, there is more damage, you can say. More the damage means the damage will be more of greater extent. The transfer of force through the body is a factor which contributes to the wounding power. If the wounding object is, for example, again, perforating bullet passes through, and through the amount of damage is less as compared to explosive bullet. So one bullet which passes through and through like this, enters and comes out. Here the damage is less because there is a hole as compared to explosion. If the explosion is there in the bomb hand, so everything will get shattered. So this is all mechanism and the factors which affect the mechanism of injury or wound. The resultant damage depends not only on the type of mechanical insult, but also on the nature of the target tissue. So on which tissue, on which target the force is applied. For example, muscle, there will be different. On bone, it will be different. On hollow organs, it will be different, like intestines. Okay. Another important factor is the movement of the body in the direction of the force, which adds up to the wounding. Okay. The person is running away from you, and if you run behind him and hit him, so that impact will cause different scene. And the person is coming towards you and you are also going towards you and you hit him, that will change the mechanism. The wounding will be different in that case. If the movement is towards the direction of the force, the damage is less, and if it is against the direction of the force, the damage is more. For example, catching a cricket ball. So cricket ball is coming towards you and you are also doing like this. The ball is coming and you are also going towards the ball. Just imagine you are playing cricket and ball is coming towards you and you are going to catch it like this. So usually people catch it like this to avoid the injury. You know that. So that is a mechanism. The cricket ball, catching of the cricket ball is a good example as far as what you call mechanism of injury is concerned, in order to understand it well. What are the main types of injuries, or what are the main types of wounds, or what are the main types of hurts? Broadly, we classify them into these three categories. One is mechanical injuries, other is firearm injuries, and the other is thermal injuries. Mechanical injuries means physical injuries. Firearm injuries means injuries caused by the ballistic instruments, that means gun, shot and all that. Thermal injuries is due to heat, burns, electricity and all that. But today's topic, that means today our topic which will be conducted in 2-3 episodes, okay, because it is not easy to finish within one shot. So we will proceed today with mechanical injuries. Firearm injuries and thermal injuries, these two topics will take some other day. Now, what is etiological classification of injuries? Broadly here, sometimes people classify into mechanical and thermal. Firearm is included in the mechanical, see, but we are going to make firearm separate topic. You can see here. So in mechanical injuries, you'll find abrasions, you'll find contusions. Contusions are also called as bruises, lacerations. Laceration, it also includes fracture and dislocation, or sometimes they make it separate. You can see that it is made separate here. Okay. and plus uh, incised wounds, stab wounds. Okay, firearm is included in mechanical injuries. Some make it a separate study. We are going to make it a separate study. And what are the thermal injuries? Thermal injuries caused due to the heat, like burns and scars, due to cold, like frostbite, trench foot, immersion foot, chemical burns, acids, alkalis. Okay, radiation burns due to X-ray and ultraviolet rays, electric burns due to electric appliances, during usage of electric appliances, or lightning burns, what you call thunderstorm, and explosive burns, what you call bomb blast and all that. So we will today limit ourselves to the study of mechanical injuries. Try to understand Today we'll try to understand the basics of injuries and basics of mechanical injuries. The rest of the parts we'll take eventually. Now, medical legal classification of injuries, if you see, depending upon the severity, we call it as either simple injuries or grievous injuries, or simple hurt or grievous hurt. There are different IPC sections for this. So that is why we have to classify this according to this type. Medical legal classification is called as depending upon severity. That is one. Another type of classification is suicidal, homicidal, accidental, or defense or false. That means suicide means during person tries to injure himself or herself. Homicide means one person tries to injure other person. Accidental means due to accident injuries caused to some person. Defense means while trying to defend an assault, some injuries are caused which are mostly on the hands, so they are called defense injuries. And false injuries means trying to make a show of injuries in order to gain something. Now, another classification or medical legal classification is depending upon moment of death. Okay, that means ante-mortem injuries and post-mortem injuries. Whether the injuries on the body are caused before the death or they are caused on the body after the death. Sometimes after the death also people try to injure somebody. That is what you call the rage of the person shows that he's trying to injure the person who is dead. Those can be separated during post-mortem examination. Other types of injuries, okay, in different view we can have these many types, like self-inflicted injuries. Self-inflicted injuries means injuries which are caused to oneself by himself or herself. Defense injuries, I told you, trying to defend or assault and you get injured. Offensive injuries means these are homicidal injuries. Offensive means you try to injure somebody else out of anger. Unintentional injuries means those are injuries caused without any intention to cause, but so that can be included in accidental injuries. Fatal injuries and non-fatal injuries. Fatal means which will cause death, and non-fatal means injuries are caused but that will not lead to the death. So these are the other wave of types of injuries. We have to understand different types of injuries. That is why I'm taking this topic to you. Okay. This you can see here, there is an image of self-inflicted injury. This lady is trying to injure herself with a blade. So this is a self-inflicted injuries. If it is grievous, the person will land into suicide. Before suicide also, you can see the cut there, a radial artery for the sake of bleeding. So that is a suicidal injury. Here you can see defense injuries. So somebody is trying to hit somebody with a knife, and the person tries to prevent it with the help of hands, usually with the hands. So defense injuries can be made out easily. They are mostly on the hands. Well, we'll go to other images. Let us add few more participants here because there is a vacancy. I notice a vacancy. Yes. Unintentional injury. The person was throwing something, or you can see the action of the person, and that gets back on his head itself. So he was see the person, other person, he has not seen, and accidentally he got hit on the forehead. So this is unintentional injuries. Okay. Now we will understand mechanical injuries. Today's topic is mechanical injuries, part first. That means we have to study in different parts or episodes. The mechanical injury is defined as damage to any part of the body due to application of mechanical force, such as blunt force, sharp force, and firearms. So firearms are included in mechanical injuries, but for the sake of better understanding, we are keeping it as a separate topic. So mostly now you can limit mechanical injuries to blunt force injuries and sharp force injuries. This damage may cause loss of tissue, and the injury which is associated with loss of tissue is usually mentioned to as wound. Now the injury which we get due to mechanical forces, they are termed as wound. Okay. Here there is an image which is showing you lots of instruments have been sustained by this man. See everywhere lots of instruments you can see, blunt instruments, sharp instruments, causing different types of injuries. You can see the lacerations, you can see the stabbing, you can see the incised wounds, you can see the bruises, you can see the contusions. This picture is showing you all types of mechanical injuries on it. Okay. Now, mechanical injury is also called as wound and hurt. After injury, what leaves behind is a wound. So that is also called as hurt. Disruption of normal structure of body tissues caused by the application of force. In short, we can call it as a mechanical injury. And the legal definition of the wound also we have to understand. A wound is where the whole skin is broken, the continuity of the skin is broken. That means even if there is a scratch on your skin, that will disrupt the continuity. So it is also called as, or if you incise it, blade जर असा मारला, ते फाटणे जो प्रकार आहे, so that breaks the continuity of the skin. Abrasion of the surface is not sufficient to call it as a wound. So that is why we used injuries and wound different words for this study. The split of the inside of the mouth are included, but not fracture or internal injuries if the whole and skin is intact. In case of wound, the fractures, they are actually not included in this. Wounds and injuries, if you want to define them separately, or if you want to separate their meaning, you can do it in this manner. A wound implies a deliberate action, while an injury can be caused accidentally. To be more precise, you can use this difference between wounds and injuries. Interpretation of injuries means how to understand the injuries. There's most important part of the forensic examination. The nature of agents causing the injuries may be identified in general terms. Example, due to a blunt object or a sharp object. I'll give you two examples here. One is blunt, other is sharp. A hockey stick can be a blunt object, whereas sword, talwar, can be a sharp object. Okay, cricket bat is a blunt object, and a knife is a sharp object. The pattern of the injuries on the body may help in deciding the circumstances in which the injuries occurred, such as whether due to accident, whether by suicide, or whether due to homicide. We can understand it through this uh, circumstantial study of such wounds. Well, we'll describe the injuries further. The nature of the wound, whether it is a bruise or whether it is an abrasion or whether it is a laceration, etc., can be understood by describing it. Next is the wound dimension. We can understand by measuring the length, width, and depth of that wound. It is also helpful to take a photograph of the wound with an indication of dimension. Example, a tape measure is placed next to the wound and we can take a dimension. Measurements are to be taken of the wound as it appears first, then with the wound edges drawn together. So sometimes the wound edges are brought together and we can measure it again. So we can describe the injuries in this manner. Further, the position of the wound in relation to fixed anatomical landmarks. For example, distance from the midline. So if the injury is here near the, below the, nipple, you can see, you can measure it and you can describe it that it is so and so centimeter away from midline, or whether it is below the clavicle or above the clavicle. This all we can describe injuries while studying. The height of the wound from the heel or from the ground level has to be calculated. This is particularly important in cases where pedestrians have been struck by motor vehicles. Pedestrian means पादचारी आपण म्हणतो त्याला. तर पदपथावरून चालणारे जे लोक असतात त्यांना जर एखाद्या व्हेकलने हिट केलं असेल तर त्याच्यासाठी आपल्याला त्याचा फायदा होतो. So this is all describing the injuries. For injuries to understand, we need to understand the anatomy of skin. We have studied anatomy of skin in first BHMS, but at least you remember this small anatomy here in front of you through an image. The skin has got mainly two layers, but below the dermis we can count it as a hypodermis. The two main layers of skin are epidermis and dermis, but the tissue which is below the dermis is also called as hypodermis. So there are several other layers, sub layers of these two layers, and it contains, for example, hair follicles, sweat glands, fatty tissue, connective tissue, loose areolar tissue, blood vessels, nerve endings. These are included in the study of skin. So this study of skin will provide you to understand the exact disruption which takes place during an injury. Now, what are the types of mechanical injuries we understand? First is abrasions, second is contusions, third is lacerations, next is inside wound and stab wound. Actually, these first five, there are five types of mechanical injuries: abrasions, contusions, lacerations, inside and stab wounds. Okay. Now somebody makes fracture and dislocation as separate, but it can be added into laceration. Lacerationचाच भाग हे होऊ शकतात. आणि फायरआर्मला आपण सेपरेट केलेला आहे. पण फायरआर्म हे मेकॅनिकल इंजुरी मेकॅनिझम असल्यामुळे त्याच्यामध्ये मेकॅनिकल इंजुरी मध्ये इन्क्लूड केलेलं आहे. अदरवाइज they can be studied as a separate topic. We are doing as a separate topic. Okay, and that is why types of mechanical injuries are types of to whole all injuries. If we take together, whether it is mechanical or chemical or thermal, they are abrasions, contusions or bruises, lacerations or fracture dislocations, incised wounds, stab wounds, firearm injuries and thermal injuries. These are all types of injuries given here. And types of mechanical injuries, if you talk, these are the five examples, five types. First is abrasions, next is contusions and bruises, next is lacerations and fractures including dislocation, then incised wounds and stab wounds. These are the five major types of mechanical injuries. Just please note that contusions are also called as bruises, and fractures and dislocations are included in lacerations. Then they become five. If you take fracture and dislocation as different, then they become six. Okay, these are the mechanical injuries which we are going to study, and injuries due to blunt instruments or due to sharp instruments. If you consider the instrument, in case of blunt instrument or blunt force caused by some instrument, there can be abrasions, there can be bruises, there can be lacerations and fracture and dislocations. These are the three types: abrasions, bruises, lacerations and fractures. And injuries due to sharp or long instruments, they are two: incised wounds and stab wounds. So there's a different force, different instruments. So we categorize into these two types. You can see here, three comes under blunt force and two come under incised wound and stab wound, as far as the mechanical injuries are concerned. Here you can see one image, and now you try to understand, you try to make out what type of injury is this. And today's webinar, I'm ending with this slide. So now you can put on your microphones and tell me what type of injury this scene is directing you towards. Anybody? Just see, look at it and just mention whether it is contusion or whether it is a bruise or whether it is a incised wound or whether it is a stab wound or whether it is a laceration. Yes? Anybody? It is a, yes.
Stab wound.
It is a stab wound. Correct. Correct, correct. And with this, we will end today's topic. That is how, that is understanding of injuries and understanding of types of injuries and understanding of mechanical injuries and understanding of types of mechanical injuries. Today evening, we will come back with the further part of mechanical injuries. That means different mechanical injuries we study at sharp 5 o'clock. And with this, I end today's webinar. Thank you. Thanks a lot. If you have any questions, you can ask me. Yes, if anybody has any question, you can ask me. Well, there are no questions. See you back again at 5 o'clock today. Thank you. Thanks a lot.